Hello, today is April 25th, 2022. My name is Julio Martinez. I'm interviewing Andrea Garcia de la Rosa for the University Library Special Collections and Archives at the University of Texas Rio Grande Valley, hereafter abbreviated as UTRGV. This project is in partnership with the Voces Oral History Center at the University of Texas at Brownsville. Please know, Ms. Garcia, that this interview will be placed in the University Library Special Collections and Archives at UTRGV and shared with the Voices Oral History Center at the University of Texas at Austin. If there is anything you do not wish to answer or talk about, I will honor your wishes. Also, if there is something you want to talk about, please bring it up and we'll talk about it. The University Library Special Collections and Archives will archive your interview along with any other photographs and other documentation you're willing to share. UTRGV University Library will retain copyright or non-exclusive right to the interview and any other materials you donate to special collections and archives at UTRGV. Because we are not conducting this interview in person, I need to record you consenting to make sure you agree with our interview procedures before we continue. So I'll ask you a series of 6 questions. Please say yes, I agree, or no, I do not agree after each question.
Sounds good.
Okay, number 1. Do you give University Library Special Collections and Archives at UTRGV consent to archive your interview and your materials at the UTRGV University Library?
No.
Thank you. Number 2, do you grant UTRGV University Library Special Collections and Archives right, title, and interest and copyright over the interview and any materials you provide?
No.
Thank you. Question number 3. Do you agree to allow UTRGV University Library Special Collections and Archives to post this interview on the internet where it may be viewed by people around the world?
No.
Number 4, do you grant the University Library Special Collections and Archives consent to share your Zoom interview with the Voices Oral History Center at the University of Texas at Austin for inclusion in the Voices of a Pandemic Oral History mini project, which will include posting the interview on the internet?
No.
As you recall, we previously filled out a pre-interview form. We used information from the pre-interview form to help in research. The entire form is kept in a secure Voices server at the University of Texas at Austin. Before Voices sent it to UTRGV University Library Special Collections and Archives, we would have stripped out any contact information for yourself or family members. So that will not be part of your public file. Your public file will only be accessible at UTRGV University Library. The final 2 questions ask for your consent on what I just described. Question number 5. Do you wish for us to share the rest of your interview in your public file available to researchers at UTRGV University Library Special Collections and Archives?
No.
The final question, question 6. On occasion, UTRGV Special Collections and Archives and Voces receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or email with journalists?
No.
Thank you for your consent. Your experience and stories mean a lot to us at UTRGV Special Collections and Archives. I look forward to what you say in the interview questions I will now ask. Hello, Andrea. So before we talk about COVID-19 stories, can you please share with us a bit about yourself and who might Andrea Garcia de la Rosa be?
Yes, of course. Like you already said, my name is Andrea Garcia de la Rosa. I'm a medical coordinator located in Casa Nueva Esperanza from Sawaski programs. I'm currently doing my master's in business administration. I'm 23 years old, and I don't know. I think that's it. I don't have much about my life.
I'm very glad that you're deciding to pursue a master's and continue your education at UTRGV.
Thank you.
So the first question I want to ask you is, can you share some memorable stories and how you first heard of or learned about COVID-19?
Yes, of course. So I don't know if you know this, but I think the first time we heard about it before that was happening in China, but the one time that actually hit us that was actually happening was when Tom Hanks came out on the news that he was the first celebrity to get COVID-19. So everybody started freaking out. And how is it possible? The nicest person, celebrity there is, and to get COVID-19. And that's how we began to become more careful with the virus.
It was starting to come out more and more on the news, right?
Yeah. So after that, everybody was freaking out. And then you see everybody running for waters and for toilet paper and for food. It was like a Hunger Games. But yeah.
Chaos all over the place. Let's go on to our next question. What were some early reports or rumors about COVID-19 that you remember back in 2020?
So there were so many. I don't know. Let me tell you one and I'll tell you a funny one, India. So the first one is like the virus getting closer to the United States from China and people dying. Then we had that the virus was transmitted via a package. So everybody stopped buying things online. And then I don't know if you saw The Simpsons. There's an actually a show, a preview of the virus happening. And it was transmitted from China, like a staff member with the packaging sneezed, and that virus got transferred over here to the United States. And that show actually aired 4 years before the virus, or actually many more years before the virus. So that's a pretty cool conspiracy theory that the Simpsons have.
Was it true after all that, the virus could spread through packages?
Well, actually, it was airborne. So the person sneezed, and I guess the things that got there once they opened it, I guess they got contagious. I'm not sure. I believe The Simpsons in a way.
Conspiracy theories.
Yes.
At what point did you realize this pandemic was a serious life-altering event?
Well, once we would start seeing the news that people were dying, the drastic change of people dying, then there was no vaccines. I actually had some friends that the parents were in the hospital for 9 months due to the fact that they had COVID and they couldn't breathe properly, so they would have to be intubated. And then one of my coworkers actually, her ex-husband died due to COVID, and yeah.
Do you remember what was like for you during the stay-at-home orders in 2020? Do you have any stories from this time you could tell?
So they're mostly like family stories. It's a fact that we might have not spent too much time like we did when COVID started, which is in a way good because we started all of us cook more. We would do DIYs together. We spend more time outside and to build a garden or things like that. Um, I guess we would just start to, like my sister says, be prepared for an apocalypse. So we would gather food and things like that, and we'll have to know what to do. So it was pretty cool.
So who would go shopping? Would it be your parents or would it be you?
So it would be mostly the people that would go out. So the people that would actually work would be my dad and myself only. So we'll be going for the food or anything like that. Due to the fact that my mom has asthma, so we would prevent her from going out due to the fact that she could actually get sick easily.
Over the last couple of years, what news, media, social media, or other sources do you rely on to keep you informed about COVID-19? Why do you prefer these news sources?
So I'm not very good with news. Most of the time, my mom will be the one that checks YouTube, Facebook, anything like that. And then I would go to work and all my coworkers would talk about it. But I wouldn't look into news that much. If anything, I will see it like in Instagram, but that's pretty much it.
You know, during the pandemic, I would hardly look at the news as well because
Really?
it was just, I thought, negative news in a way.
Okay.
So I kind of decided not to pay attention to the news.
Interesting.
Yes. Let's go on to the next question.
Mhm.
Can you share with me what you understand about COVID-19 as an infectious disease and how you feel it's impacted society?
Well, I do understand it completely. Like I said, um, the virus is something big that happened and is still occurring, of course, as not as much as before. Uh, but like I said, it was something really dramatic that happened and changed. And we thought maybe just for 1 year, and it's been almost 3 years. So yeah.
Likewise, can you share with me what you don't understand about COVID-19 and wish you could know more about?
I think I would like to know how it came about. Like, of course, it started in China, but who, how, why? Like, was it because of an animal, or was it because it was man-made or anything like that, right? You know, it's conspiracy theories.
Maybe like the true origin, right?
So we could like not, so we could prevent it and not happen again, of course. It's like a zombie movie that you try to find out from where it came out.
Yes. Do you feel your family has the same beliefs as you about COVID-19, or are there some members who take it more seriously or lightly? How so?
Well, I do believe so that we have the same beliefs. We all still wear masks when heading out or wear a hand sanitizers at all times. My younger sister's always with the mask, even though all are all have the three vaccines, the two vaccines and the boosters. So, I mean, it's still something very highly that we look out for.
Awesome. Thank you. The next part asks you to share any stories about COVID-19 vaccines and any vaccination related stories you may wish to tell. Okay. So did you get a vaccine and any follow-up booster shots?
Yes, I got all three.
What was it like? Was it easy or difficult for you in terms of scheduling wait time?
So, one of my friends at the beginning of COVID used to work in the Valley Regional Hospital here in Glory. So I would get in contact with her. I'm like, hey, my parents got the vaccines first because it was like older people first, right? And then it was health care workers. And I was like, hey, can you hook me up? He's like, okay, yes, just come, do this form, and we'll get you the vaccine. So I was like, okay, perfect. So I got there. I get out of work at 7, and I had to be there before 8 due to the fact that I didn't want it to be the last one and go to sleep until 12. So I showered quickly and headed to the hospital. Of course, that was a big risk due to the fact that everybody was in the hospital, but of course, they had like a different section. The line was pretty short. Then the booster was in CVS due to the fact that it was like 6 or 8 months after I got my second vaccine. So that one was pretty fast too because nobody was asking me for it when I was trying, but they had like different schedules online.
Okay. Can you share a memory from the place where you were vaccinated or boosted?
So in the hospital, like I said, they would have us in a different section. So after they put the vaccine on you, you will have to be waiting like 10 minutes so they can verify that how I said you don't get any symptoms from it.
Like a reaction?
Yeah, exactly. So we just have to wait, and then I did one person did start coughing, so everybody freaked out, and I was like, oh, thank like yeah, it's gonna happen to me, but thankfully no.
Were you ever hesitant in getting the vaccine?
Um, I believe everybody was, due to the fact that we weren't sure if it was actually gonna help out or not, and that when we would try to do the lines that they would have like in McAllen or Fresno's with the cars, it would take forever. So I was not hesitant, but I was also in a way 50-50 because I was working with kids that actually come out positive. So of course I was in need of the vaccine.
So thank you. We're going to move into our next section, which is personal impacts. The
Okay.
next set of questions, Ms. Garcia, are going to ask you about how COVID-19 has impacted your life in the way of your career, your family, and your advocacy in your employment. So let's go with family. Ms. Garcia, in the pre-interview, you shared that you have family also living in Texas. Has COVID-19 impacted your family life in terms of the way you interact and visit with one another? Can you share with me some stories or examples on how you and your family have adapted your family interactions during the pandemic?
There's, of course, since COVID is still going on, it's still really hard. I remember the beginning, it was really hard due to the fact that every Fridays of the week we will go and hang out, like the full family, like my uncles, my cousins, everybody from my mom's side to my we will go to my grandma's house. So when COVID started, we were not able to do that because we were scared that our grandparents would die or like they would get sick. So then I believe there was a holiday after that. I believe it was Easter or something like that. And our grandparents actually sent us a video saying how they missed us and hope that we were doing, and they start crying. So we all cried, right? And things like that. And then something recent that happened was in December that one of our uncles, or actually our grandparents, actually did get COVID positive. So when New Year's came around, my family and I actually did something very different, and we spent New Year's with us five together in our own house. So yeah, those are some of the memories or things that impacted our life with COVID.
Thank you.
Uh-huh.
How has COVID-19 impacted the lives of your parents? Did they believe in the pandemic to be real? If so, please elaborate.
Yes, we all actually believe this real, and we still do. So we all still take precaution of it. So, uh, especially with me, due to the fact, like I said, I was working as a medical coordinator with kids that have COVID positive. They would even take precaution with me. So they would like, okay, you have to shower every day, every time you come in. So there you go, every day, getting out of work, showering, brushing your teeth, or anything like that to prevent contact. And I would always be in a distance with them, so I could nothing bad could happen.
You shared with me, you shared with me that your parents lived with you. How did this
Yes.
impact your daily routines in your home?
So I did mention right now that I will have to shower every time get back from work, but I will also have to put all of my work attire to wash at that moment. And of course, I would lock myself for a few hours because I mean, I'll wake. I used to, I work at night shifts, so I'll wake up around like 4, 3 in the afternoon. So by then everybody's already like already ate or anything like that. So I go eat. I will go eat and then come back into my room and lock myself in. And yeah, that's pretty much it.
What do your parents think about COVID-19? What extra precautions are you and your sisters taking to minimize any exposure to COVID-19?
Well, even if the COVID hasn't ended for years, we're still taking precautions. Maybe as not as much as before due to the fact that we're all vaccinated, but we still use the hand sanitizer at all times. We have it in the car, in our bags, or we wear a mask when we go out to public places. So we're still taking precaution.
Thank you so much. Okay, we're gonna be shifting into work-related challenges, Ms. Garcia. Let's talk about the work you do in helping children. Ms.
Okay,
Garcia,
perfect.
Ms. Garcia, you've been employed at your nonprofit organization that helps on providing asylum for unaccompanied children as a medical coordinator, correct?
Yes.
How have you seen COVID impact your work? For example, when were those impacts first experienced and how has COVID-19 impacted your practices since it first began in 2020?
Well, actually, I was the first one to receive COVID positive results. Um, when my boss actually sent them out, but didn't notify, and I started freaking out because we had to separate the kids, right? So um, when all of that happened, nobody wanted to help out the kids or go inside and check how they're doing. So I would have to be the one to take the risk and let's see how you're doing. Because of course you're taking care of kids that are unaccompanied, right? So you cannot make them feel like if nobody wants to help them out or anything like that. So I was always taking the risk on checking on them.
Thank you. As a medical coordinator, did you have to utilize more remote online platforms for the well-being of unaccompanied children?
No, we would actually have a doctor, specific doctor of a clinic that uh, would come in and do vaccines for them, and then he would also check on them. And then that's something else that we would have done with our the X-rays. So somebody specifically from that office would just do COVID cases or kids with symptoms, and that's how it would work.
Have you had to take on any extra work duties because of COVID-19?
Yes. So when COVID started, some staff would actually have symptoms and they will be quarantined, or some staff would actually be COVID positive. So I would have to do work overtime or stay longer due to the fact that we didn't have staff. So in the third shift in third shift where I work, there's only like two people. Well, I started with only two people, me and another staff. And that other staff got COVID. So I would have to do, instead of working 4 days, I would have to work 6 days out of the week to prevent, so we could have coverage. And then that one day, somebody else from the morning shift or second shift would come in and do that third shift.
What kinds of policy has your nonprofit organization enacted in response to COVID-19?
So some of the policies that we have there is to wear PPE, which is proper clothing, which is like the gown, the goggles, gloves. We even have shoe coverings, and of course the mask, which is like a KN95 or N95, depending on what case it is. And another thing is to report any symptoms or any contact if you had with COVID positive cases.
When COVID, do you know of any employee or support staff member who has received a pay cut, lost work, or has been or lost?
Well, actually, when COVID began, people had the opportunity to choose to work from home or work in the program itself. So half of the people left to work at home, but they would have to be doing ADLP, which is like just the same thing, but they would just be watching videos and doing trainings or things like that. So it would be from 8 to 5, and of course, we would just take the risk and come to work ourselves.
Thank you. Final questions on the COVID-19 pandemic, okay? This last section asks you to share any stories that you may have about this pandemic and the response by local, state, and national elected officials.
Mhm.
Feel free to respond or pass on any of the questions.
Okay.
Do you feel satisfied with the local response to COVID-19 in Brownsville and Cameron County over these last 2 years?
I do. They actually helped out a lot in the communities due to the fact that they will obtain the vaccines and not only that, but also food or essentials that they will give out to the community so they could help us out.
Are you satisfied with the state response to COVID-19 led by Governor Abbott over these last couple of years?
I believe so.
How do you feel about the national response to COVID-19 led by President Trump in the year 2020 and the President Biden from 2021 to present?
So when 2020 happened, there was a lot of crazy thing happening with Donald Trump. Like he would say to inject Lysol, so that way you don't get the COVID virus. But another thing would be a good thing that he did was to provide grants for people that lost jobs or that need help with anything like that. So that was a really good thing. And with President Biden, of course, he'll help out for everybody to obtain all of the vaccines and the booster shots.
If you had the power of a political office to respond to COVID-19, what would you do differently?
I would have probably raised the amount of money the first responders receive. Because of course they're taking the risk to provide help and preventing the virus to happen more.
This is a special year in our national democracy because it's a midterm election voting year. Do you plan to vote? And if so, is the issue of COVID-19 going to factor into your votes?
Yes, I am going to vote, but I'm not sure that COVID-19 will be an issue to it.
Will you consider the national response to the COVID-19 pandemic in your vote for a presidential candidate?
I'm not sure. I didn't think about that when voting or thinking about voting.
Is there anything else you would like to share with me about your experiences with COVID-19 that I have not asked about?
No, well, actually, just that the virus hasn't died out yet, and I'm pretty sure it's not gonna die out anytime soon either.
What impact or purpose do you hope your story may have on listeners of the Voices of a Pandemic digital archives?
Um, I guess just the only thing is that um, I really wish that none of this could happen to anybody. I seen little kids or even friends going to emergency rooms or anything like that due to the virus. So this is something I would like or would like for it to be prevented for nobody to go into those experiences.
Thank you, Ms. Garcia, for sharing your stories with me and the Voices of Pandemic Oral History Project. Have a good evening.
Thank you.